we're going to get into the pec clamp in this practice. And what we want to be doing with our pec clamp is separating the pec major from the pec minor. Oftentimes our pec minor, which is deep to the pec major, is adhered to our pec major, and in an ideal situation it wouldn't be. So it can be really helpful to see if we can facilitate some space between those layers and some movement between those layers. So to do it, we want to position the arm out to the side but bent at the elbow so we can get a little bit of external rotation. That's going to give us a little bit more tension on pec major, which is going to help us to get a little bit more underneath it with our thumbs. Okay. Also, I should let you know that this can be quite intense. You can use it to work on pectoralis minor specifically. If you do that, know that the intensity of that work is quite a lot, which means that for now, at least the first, what I'll show you is to go between the layers, and that should be a little bit less intense and also less work for your thumbs. So now that you've got the arm positioned, try to use both of your thumbs next to one another, and you can see the border, the lateral border, inferior border of pec major. Press on the border so much so that you can dip in underneath it. Once you've dipped in underneath it, then just swim a little bit, little by little, incrementally getting more depth, and then I'm going to try and straighten my arms. And now that I'm in between the layers of tissue, I'm going to add in a little bit of weight. The direction of my pressure is up towards the clavicle and in towards the neck a little bit. How are you doing there?
I'm okay.
Yeah?
Yeah.
You've got a good amount of space here between the layers. For someone who's got more adhesion between these two muscles, it's going to be a little bit more intense.
Yeah, I mean, there's a level of sensation.
Yeah. Whenever we're thinking about facilitating space between layers or movement between layers, we want to think about time under tension. So this is one of those ones where we hold for a good length of time in order to encourage the fascial tissues to reorganize themselves. If we were going to focus more specifically on pectoralis minor, let's say in your assessment of your client, you've decided that pectoralis minor could use a little bit of attention, maybe there are some trigger points there that you've identified. If that's the case, all we do here is we modify the angle just slightly. So instead of me going up towards the clavicle and towards the neck, I'm still angled towards the neck, but this time I'm going to go down a little bit more in towards the rib cage. If I do that, it's only a small change in direction, but it's typically a significant change in intensity. Not for you? That's great. That's good. A happy pec minor will not give you much more sensation, although I feel like that slight move, no, it's all right.
Give it some more.
Give it some more.
Oh, no, it's all right.
Oh, great. Good. Wonderful.
Yeah, if anything, in between was more.
More intense.
Yeah.
Oh, great.
Yeah.
Brilliant. That'll be a rare situation. Rare bird there, fiend.
Well, we know that.
We know that, don't we?
Yeah, do.
When you come out, go nice and slow. It can be quite pokey in there, so it's a nice thing to just do some sweeping. Maybe also just take the tissue with a broader surface area of the hand, move it around a little bit. That just helps to reduce any sort of residues of sensation of that pokiness. And then we'll do the other side.
What would be the trigger? But like, what would you look for in your clients as like trigger points and things?
The resistance of the tissue locally. So whatever I'm feeling in the chest
Yeah.
typically gives it away. expression, change of breath, but also one of the things that we look for with trigger points is the fasciculation of the muscle or the surrounding muscles. So if I'm pushing on a trigger point, oftentimes what will happen, not all the time, but oftentimes there will be a local response in the muscle that's kind of like various fibers twitching, but on a smaller scale.
Okay.
And we call it fasciculation.
Do we?
Yes.
Yes. I probably won't know.
Yeah.
But also in terms of their move, like in terms of what your client says to you.
Oh.
Like why would you?
Yeah,
why would you go poking?
They would
in the
have
first place?
restriction in things like elevation of the shoulders.
Okay.
So you get a decreased range of motion. You might even get some discomfort in the front of the shoulder as they try to do that.
Okay.
You'd also probably get restricted retraction of the scapula, and then any movements that sort of require retraction. So
So they
extension.
they also might have forward shoulders and a bit of forward head stuff.
They might, yeah. Forward shoulders in terms of like rounding forward is a little bit more pec major.
Okay.
Pec minor is forward shoulders, but more like tipped forward. So you're thinking more of an anterior tip of the scapula, and so you might also see the apex, the inferior angle of the scapula, pointing out posteriorly as your signal, without necessarily seeing too much of the shoulder coming forward. It might just be tipped.
Yeah.
Okay?
Yeah. Thanks.
No worries.
I think if there's anybody that.
So then we'll do the other side. So yeah, thinking about maybe some people who might present with those characteristics.
Yeah.
So we get a little bit of external rotation that gives us a little bit of a line of tension with pec major, and that'll help us to identify the border and also then go deep to it. We bring our thumbs in, start to swim around a little bit, so sort of moving the thumbs side to side just to find a nice avenue. Once you've found a nice avenue, then straighten the arms and lean in. Pressure directed towards the clavicle and in towards the neck. And this is going to help encourage some space and movement between the layers. This side? Fine. Great.
Yeah, this side's less than that side.
Glorious. So for anyone who really needs this kind of work, you would stay for a good period of time so that those connective tissues have an encouragement to reorganize themselves.
What's a good period of time?
2-3 minutes.
Okay, a good period of time.
Yeah. Yeah. Much the same as something like the fascial stretch for the sternocleidomastoid, which is in another video. That one you also want to hold for a good period of time. Same idea. For now I'm going to release that and then change the angle just slightly and come in a little bit more towards the rib cage in order to see what's in pec minor. But this feels, yeah, same as the other side, really. That's great.
Yeah, got one muscle behaving itself.
Lovely, yeah. Another thing that you might encounter with either an overactive pec minor or a pec minor with trigger points is upon flexion of the shoulder, so as you reach the arm up, they might have some discomfort in the front of the shoulder.
Oh, okay.
Because what happens is the scapula can't upwardly rotate and posteriorly tilt as much as it needs to get the action of full flexion of the shoulder without the glenohumeral joint sort of taking over.
Oh, okay.
Yeah. So you might find that as well. It limits the range, or at least limits the range of movement of the scapulocostal joint. So we can release that, a little bit more of a broad surface to finish for this pec clamp. Just to take away those pokey residues, and then a little sweep. See how
yeah.
you're welcome. See how you go with that.